bring it back to reality now. I'm happy to speak to healthcare motions, particularly to this one because, frankly, half my riding is located in Peel Region. And I want to tell you a story. So the story is that on my BlackBerry, I have a photo. And the photo is a gurney. It's not a hospital bed, Speaker. And the reason it's not a hospital bed is because hospital beds don't fit in supply closets.
Oh, wow.
So when I went to visit, I was told down the hall to the right, 4 doors opposite of the ice maker. I'm thinking, that's odd. Why wouldn't they just give me the room number? Well, of course, they didn't give me a room number because there was no room number.
Shame.
So I have this photo. It's a gurney. It's not a hospital bed. And I look in. There's no light, Speaker. There's a little desk lamp. And the electrical wire is actually outside and attached to a hall outlet. And again, I thought, that's odd. But of course, why would there be in a supply cabinet access to electricity? Oh, and when they had to clean the hallways, they actually unplugged that light. So the person I was visiting was in the dark. And then there was a little bell. Now, Speaker, you might remember those little bells. We often saw them in small retail operations where there was one person manning the retail store, and they might be working in the back. So on the front, they would have a little bell, little ding bell. That's what they had in their bed. That's what they had in the supply cabinet. Speaker, this was in March. So please don't tell me, as the member previously from Etobicoke said, that they're working around and tinkering with the edges, because I say no, that is not the case. And this, by the way, this story is not from Brampton Civic, William Osler. It's actually from a community in Simcoe County. So to suggest that we shouldn't take the time to debate and talk about the challenges and the problems and the solutions in our healthcare system for an afternoon is, to me, so disingenuous. There are so many opportunities for improvement. I remember, and last week was Nurses Week, so I met with the Peel RNAO, and of course, the hospital in my community, Headwaters, was talked about, but obviously so was William Osler. And I said, what are we going to do? How can we actually move away from hallway medicine, from alternative level of care beds? How can we move away from something that we learned 7 years ago when we did the Select Committee and we started hearing that phrase, the tsunami of dementia? Remember that? That was 7 years ago. We've had, you government members, have had 14 years to actually prepare and get it right. And instead, what we have is these mini announcements, these promises of things to come, these promises of, I think it'll get better this time. Just be patient. Well, you know what? People are tired of being patient. They're tired of waiting on a government that promises more than they deliver. They're tired of waiting on a government that tinkers with the edges, as the member from Etobicoke just said. They want to see action because the story that I just shared about the gurney in the supply cabinet, about the hallway medicine in Brampton Civic are not unique. We all have stories like that. We could go up and down and talk to the 107 MPPs, and I'm sure they have all had either personal experiences or heard from constituents who are dealing with this issue. Why do we think that in today's Ontario that is good enough? Well, I don't think it is good enough. I think we owe it to our citizens, we owe it to our seniors, we owe it to the people who actually need the care right now to get it right. And, to put it more bluntly, to get it done. 14 years, and we're still talking about issues where people are in hospital beds in a hallway. In April, I asked the Minister of Health in a question during question period about a very specific example. 5 days, my constituent's daughter was waiting in the hallway for help in Brampton. That was in April. These are not anomalies anymore, Speaker. This is the status quo. So we can have great conversations about why we should test our blood pressure and why we need to look after ourselves, but we need to solve the problem. And the problem is that you are not dealing with it. You're tinkering. You're fooling around. You're not actually saying alternative level of care beds. Do you know what we also call ALC beds? Bed blockers. Do you know why we call them bed blockers? Because they need to be served and assisted in some other form of health care. Many times, it's long-term care. So then you look, 14 years. What has the government done for 14 years to make sure that long-term care beds are there when we need them? Oh, that's right. They just made a promise today. 14 years, and we get another promise.
Yeah. Can't believe them.
Are we not tired of the promises? Are we not ready to say, that's not good enough anymore? I want to be able to visit my loved one closer to where I live. I don't want to have to travel 2 hours to help my mother or my father or my grandparent when they're in a long-term care bed. That's not what I envision for Ontario. That's not where I'm at. I don't accept that as good enough. I don't accept that as we're willing to tinker around the edges. I think it's so sad that we've got to the point where you're just making a mountain out of a molehill, Sylvia. You're making it worse than it sounds. Well, I'm not, because I lived it. I saw it. I have the picture to remind myself that we are not doing a good enough job for our people in hospitals, in long-term care, in institutions. And after 14 years, I frankly think that the public is sick and tired of the promises, is sick and tired of the tinkering, is sick and tired of the attempt to appease us with minor announcements that you're going to get something in the near future if you would only just vote for us one more time. Enough. You've had 14 years. It's time to figure it out. You have the studies, you have the reviews, you have the stories, you have hospital administrators, you have LIN chairs telling you what is happening in your communities. Now, all you have to do is act on it. Thank you, Speaker.